more than 5 years to
Yes.
figure out what those are. But
Yes.
we can make that kind of decrease.
Right, and that kind of commitment is really what we're looking for, just from the general public, from health professionals, to keep it going. Of course, we're probably not going to figure out the 50% of the unknown causes of prematurity in 5 years, but we can start the ball rolling.
But one thing that fits in with the other mission of the March of Dimes is that when one of the goals of the March of Dimes is decreasing infant mortality, which is defined as the death of babies before getting to be 1 year of age, a lot of these babies were premature babies who had severe complications, and they died before their year of age. So we can decrease prematurity. We'll be working also towards decreasing infant mortality.
Right. And I presume also educating the moms and the fathers in the neonatal intensive care unit on what to look for. I know my 3-pound 11-ounce got a cold and turned blue, and luckily that happened in the hospital because somebody, had recognized it. But if that had been at home, she would not have been here. So that these, when you are a premature baby, something like a cold can kill you.
Yeah, you just said a very important point, and the March of Dimes is looking into some of these things. The fact that the paternal health is very important too.
Yes.
in the creation of a baby. Not just the health of the mother, but the health of the father is very important too. The drug usage in the fathers, all these things are important too. And it's just been a few years ago that people started realizing that this is very important also.
Well, a lot of times you say you're having a baby, and you look at the mom.
Mm-hmm.
But now, and I think it's been in the last year or so, there's been a huge emphasis on we're having a baby. Mm-hmm. And it's not, what are some of the things that that the father, I mean, you mentioned drug usage, but medically in simple language, if you can, what other things should we be in
well, the father should have also good nutrition and should also be a supportive person, because the health of the baby and the health of the mother are not only just a physical thing, they're also a social and a mental conditions that are going to improve the health of the baby. So if the mother is stable, is in a stable home situation, is not in an abusive situation, is in a comfortable home and is good nutrition, good food, and doesn't have a lot of stress and doesn't have to work very hard and to just keep up with ends and stuff, because the father is a very supportive person, then the chances are that the pregnancy will come to term and do better. So not only are the factors physical, but also social and mental factors are very important too.
And any kind of anger problems or domestic abuse are really bad. And I know I've seen several videos in the last year of the trauma, emotionally, not just physically, but emotionally, on the baby in the womb if the mother is being abused. And so that the problems, if the mother or the father have problems with drug, alcohol, anger, any kind of abuse, that needs to be taken care of. With the prematurity too, I think there's some issues about, it's just good to have a doctor's appointment before you have a baby, before you even think you want to have a baby, just so that the medicines you're on, any kind of family or social history can also be important in this.
Yeah, even though prenatal care has not really proven to decrease the amount of prematurity, it is a definite fact that mothers who have prenatal care have premature babies that are healthier than other premature babies of the same gestation who did not have that adequate prenatal care.
So, and the other thing that I've read recently is that in studies where they've made sure that moms got the prenatal care. In other words, you're 3 months pregnant before you see a doctor. Mm-hmm. Mm-hmm. And the important time is already passed. So that I think this is part of the reason that the whole campaign also is trying to educate people, mostly moms, mm-hmm. but both mom and dad, to get to the doctor and make sure that there is nothing in their work environment, nothing in their home, they're not painting. That there's so many tips that March of Dimes can share. Mm-hmm. Janine, how do we find out this? How do people, I think you have a phone line mm-hmm. that you can call and ask what you might think is a silly question, but in mm-hmm. this case there are absolutely no silly questions.
That's right. There are a couple of phone lines and also a web-based center, which is called our Pregnancy and Newborn Health Education Center. formerly called our Resource Center, and we have a couple of different resources that you can use. On the web, our www.marchofdimes.com website, you can print out any fact sheet that you would like. If you have a question about cerebral palsy, if you have a question about teen pregnancy, if you have a question about smoking during pregnancy, which we've talked about, you can just print out a fact sheet right off the web. You can also email questions to that Pregnancy and Newborn Health Education Center, and that email address is askus@marchofdimes.com, and you will get a response. You can also call our division offices. We really try to keep abreast of what's going on in our local communities, such as Springfield, such as Chicago, and try to keep a resource guide so that we can, although we don't provide direct service, we can provide people to and get them connected to the resources they need on the local level.
Let's talk a little bit about audience, because when you go on your web page, you're not just talking to moms and dads.
That's right. One of the things that I think the March of Dimes has really done well and has actually won awards for its website is that you'll see at the top there'll be different headings. One of them is professionals and researchers who may be looking for grants or who may just be looking for the most updated information that they can get their hands on. Also mom and dads, but we also, one of the things that I always talk about is we need to make sure that the support system, like the father, such as the grandma in some cultures, the mom of the pregnant mom is a very reliable and solid source of information because they've been there. So making sure that those people also around that mother have the most accurate information and have it in terms that they understand, which I think is really important. There's also nursing modules. There are continuing education modules for both physicians and nurses that can be downloaded off our website.
When you say information that you can understand, March of Dimes has put together some easy-to-read materials that are at the 5th grade level.
Yes.
And they are wonderful resources, so that those also can be requested.
Yes.
That anybody can read. So I think that is very important, because when it comes to medical terms, we need to understand what we're talking about. And you know, just it's hard. They're hard terms, and it's complicated. You know so much, all the technical things. You're basically this technician, you know, keeping this baby alive in the intensive care unit, and a parent can't understand that, but they can ask they have to understand the important things. What can I do? What is my role? You know, how can I keep this from happening? How can I help it once it does happen? As we talk about that, so you know, you're talking about all the you know, the aims. You have about 5 different areas that you're working on. Let's kind of review those again. We've talked all around them, but
sure, we've talked about the goals, but you're right. There are 5 aims to get us to the place we need to be with those 2 goals.